In the third section of our lecture, now we will discuss some common disorders of the oral cavity which are due to the trauma, neoplasm, and as a result of some skin disorders and the blood disorders. So mainly we will talk about skin disorders, blood disorders, trauma, and then also some neoplasm that affect the oral cavity in this section. Trauma and neoplasm of the oral cavity. The ulcers are maybe, we talked about the ulcers of the oral cavity which are due to different infections in our previous section, and we discussed the ulcers due to the viral infections, bacterial infections, and fungal infection. But ulcers in the oral cavity are also due to the trauma to the oral cavity, and usually these trauma are due to the jagged tooth or ill-fitting denture. If the patient is using the denture or they have denture, ill-fitting dentures is very common cause of ulcer in the oral cavity due to trauma. Also due to cheek bite, injury with foreign object also lead to the ulcer in the oral cavity. Ingestion of acids or alkalis, even if somebody eat hot food, too much spicy food, that can also cause the damage to the mucosa of the oral cavity, leading to the ulcer formation, and that's very painful unless it's cured or treated. So these are the pictures of some ulcers or lesions as a result of the trauma or injury. Aspirin burn. Aspirin can also cause the ulcers in the oral cavity. Then some ulcers due to neoplasm, like they present as chronic ulcers. All the ulcers due to trauma are the acute ulcers. They are of short duration. They are not the chronic type of ulcers. They occur, they have a short duration, and they are treated and they are cured. But the ulcers caused by the neoplasm or cancers are the chronic type of the ulcers. They are of long duration. Squamous cell carcinoma, and then we have minor salivary gland carcinomas or non-Hodgkin lymphomas, or these are the neoplasm of the oral cavity that involve the oral cavity and cause ulcers, like salivary gland tumors, in which the parotid gland cancers are the common. Then we have non-Hodgkin lymphomas, squamous cell carcinoma. All these are the neoplasm of the oral cavity or neoplasms that cause the ulcers of the oral cavity, even though not the direct involvement from the different structures. It spread to the oral cavity and cause ulcer which are chronic in nature, and they are not the acute ulcers. Skin disorders that can lead to the oral cavity disorders, we have like erythema multiforme or multiforme. We have due to drug allergy or herpes infection. There is lesion of oral mucosa, ulcers covered with pseudomembrane, hemorrhagic crust and bleeding, and the treatment is by the steroids. So all these are the due to drug allergy, erythema multiforme. These are the redness, erythematous is the red lesions of the oral mucosa, and ulcers are covered with pseudomembrane, false membrane, not the true membrane, and there is bleeding and the crusting. This is the picture. You can see bleeding and the crusting, and ulcers are covered by the pseudomembrane. Then we have pemphigus vulgaris. Pemphigus vulgaris is autoimmune disorder. Oral and skin lesions present. Usually it's common in older people. And again, treatment is with steroids and cytotoxic drug. So this is the pemphigus vulgaris. Both these are due to skin disorders and due to drug allergies or herpes infection. And then pemphigus vulgaris is autoimmune disorder in which the immunity is weak, and this develop mostly in all older people in which the immune system is already suppressed, is not very good. Some other skin disorders include the benign mucous membrane pemphigoid, autoimmune mucosal lesions, conjunctiva also involved, bulla with clear or hemorrhagic fluid, treatment steroid. So again, benign mucous membrane pemphigoid in which there is bulla formation. Bulla are the swellings which have the maybe with the clear fluid or the hemorrhagic fluid, blood fluid have contain. Also, this is mainly in people who have autoimmune disorder, and it's autoimmune mucosal lesion. Lichen planus. Lichen planus is oral lesions on forearm and medial thigh, reticular on mucosa, erosive on mucosa, gingiva, and lateral tongue. Again, here we have oral lesion, and it's also present on the skin of the forearm and medial thigh. The type of lesion which is present, reticular on mucosa, and erosive type, it invade and erode on mucosa, gingiva, and the tongue, lateral surface of the tongue. Chronic discoid lupus erythematosus. Chronic discoid lupus erythematosus, again oral and skin lesions, similar to erosive form of lichen planus. It erode and it invade, and similar to erosive form of the lichen planus. Some blood disorders that can cause ulcers or disorders of the oral cavity. We have the blood dyscrasias due to lack of immunity, investigated by blood film count and bone marrow aspiration. So different blood dyscrasias, different blood abnormalities cause the disorders of the oral cavity. Even people who take aspirin, which is the blood thinner, their gums bleed a lot when they do the brush, and even without the brushing they have bleeding from the gums because the blood becomes thin. And people who have different bleeding disorders, they have this bleeding from the mouth. So different blood conditions can affect the oral cavity. We have three types of the blood cells present. We have the red blood cells, we have platelets, and then we have the white blood cells. White blood cells are the cells that fight the infection. Red blood cells carry hemoglobin, which carry oxygen to different parts of the body because of the hemoglobin present in the red blood cell. And then we have third blood type, which is the platelets. Platelets are the cells which help in the clotting. So any blood dyscrasias, bleeding disorders, their platelets may be affected. They don't have the clotting process occurring properly, and then it has bleeding disorders. All these are blood conditions. When they cause the bleeding disorder, there is bleeding in the oral cavity and leads to involvement of the oral cavity. So the diagnosis is by by the different tests performed on the blood. We have like complete blood count is very important. That gives the idea where what's the count of the white blood cells, platelets, and the red blood cells. Also differential count is important. That gives the individual count of each cell type. And then bone marrow aspiration to find out if there is any abnormality of the bone marrow condition like leukemia, which involves the oral cavity. So all these are the different investigations that should be performed. Acute lymphoblastic type disorder, acute myeloid type, then we have agranulocytosis, cyclical neutropenia, and pancytopenia. All these are the different disorders that can affect the oral cavity. We have lymphoblast type, myeloid type, agranulocytosis, neutropenia. Neutropenia is the neutrophil is the white blood cell, very important for fighting infection. Neutropenia is decreased level of those neutrophils, and there is increased infections in people who have neutropenia, and there is pancytopenia or decrease in all the white blood different types of cells. Pancytopenia is all the type of the blood cells, they are decreased or they are affected. So these are some blood disorders that can affect the oral cavity. So this was all about our section 3. Thank you for watching sqadia.com.